Nandrolone phenylpropionate, also known as NPP. The first thing that you should know is that this anabolic steroid has a lot of the same properties as the compound, nandrolone decanoate. Actually, nandrolone phenylpropionate was marketed first, during the 50s. It was sold commercially under the brand name Durabolin. The company that made and sold Durabolin was called Organon. Later on, Organon would create a second formula, nandrolone decanoate, which was branded as Deca-Durabolin. Nandrolone phenylpropionate history. This anabolic steroid has a small ester base and it's known as NPP for short. It's never achieved the same popularity as decanoate, which has a large ester base. This is primarily because the decanoate formula was easier to buy. It was sold in more places. However, these days, underground labs are producing nandrolone phenylpropionate and this is boosting its popularity. It's being used more often because it's easier to access. It's being made in underground labs because it isn't legal in America and many other parts of the world. It's actually tough to find NPP, although it's easier than it used to be. This steroid is legal when it's prescribed for a medical condition. However, most people who want it are looking for it because they want better results from bodybuilding. A doctor won't prescribe it for this reason. Why use nandrolone phenylpropionate? This anabolic steroid offers a host of performance benefits and therapeutic benefits. Aside from testosterone, the hormone known as nandrolone is the anabolic steroid which is most prescribed by doctors. However, the decanoate formula is the most commonly prescribed form of nandrolone, rather than nandrolone phenylpropionate. In general, people who use nandrolone tolerate it very well. This isn't to say that there is no risk of side effects. It's an anabolic steroid and they all come with the risk of side effects. Properties of nandrolone phenylpropionate, NPP. Now, let's look at the traits and function of this anabolic steroid. In terms of its scientific structure, it is an anabolic androgenic steroid of the 19-nortestosterone type. When the 19-nor classification applies, it means that a testosterone hormone structural change has taken place in the 19th position. The change is that the hormone's carbon atom has been eliminated in position 19. When this change is made to testosterone, nandrolone is created. When a short ester called phenylpropionate is added to the changed formula, which is nandrolone, nandrolone phenylpropionate is created. In terms of how nandrolone phenylpropionate functions, it's just the same as nandrolone decanoate. Each one is made from the same hormone as the other. However, with NPP, nandrolone phenylpropionate, the half-life is shorter and the burst of nandrolone is bigger post-injection. Basically, if you're interested in keeping your blood levels stable, you'll need to inject NPP more than you'll need to inject nandrolone decanoate. In terms of how NPP compares to testosterone, it's more anabolic, but not by much. To put it into perspective, testosterone has a 125 rating, while testosterone has a rating of 100. It's much less androgenic than testosterone, with a rating of 37. Testosterone rates 100. Decreased androgenic properties are because nandrolone reduces to DHN instead of reducing to DHT. For this reason, NPP is easier for males to tolerate in high doses versus testosterone. DHN stands for dihydronandrolone and DHT stands for dihydrotestosterone. In addition to being less androgenic, NPP is not as estrogenic. NPP aromatizes testosterone 8% less than testosterone does. As well, you should know that nandrolone phenylpropionate has the nature progestin, which impacts its side effects. NPP has a lot of the good properties of other anabolics. However, it goes further by outpacing other steroids in terms of what it can do for the human body. To explain, we'd like to share information about the best traits of NPP. Noted positive effects of nandrolone phenylpropionate. Significant anabolic qualities. High quality, but slow, lean tissue gains. Excellent post-cycle lean mass retention. Low-moderate water retention. Low aromatization to estrogens. Moderate strength and weight gain. Noted improvement in joint, soft tissue function. Excellent protein-sparing, anti-catabolic qualities. Inhibition of fat synthesis. Increased metabolic rate. Does not reduce to DHT, dihydrotestosterone. Very low moderate HPTA function inhibition. Dose dependent. Increased muscle glycogen synthesis. Increased creatine phosphate (CP) synthesis. Reduction in total triglyceride and cholesterol levels. Beneficial, improved insulin metabolism. If you want more production of IGF-1, which is insulin-like growth factor, NPP will deliver. IGF-1 is a powerful hormone which is anabolic and it will assist the human body with recovering from training. This important hormone plays a role on a host of cells. As well, NPP will inhibit glucocorticoids. Glucocorticoids are cortisol stress hormones which play an important role in how we feel and in how healthy we are. However, it's not a good thing when our levels of glucocorticoids are too high, as this may lead to fat gain and muscle loss. When we get a lot of physical exertion, we're more likely to have higher level of stress hormones. The hormone, nandrolone, is able to decrease stress hormone production. Another advantage of NPP is that it will boost the retention of nitrogen. Our tissue for muscle is made up of 16% nitrogen. When retention goes down, we enter a state which is catabolic. The more we keep, the more anabolic our bodies are. Nandrolone phenylpropionate will also increase the synthesis of protein. Protein synthesis is the pace at which cells will build proteins. Proteins are muscle tissue building blocks. Also, nandrolone will boost the hour counts of red blood cells. These cells deliver oxygen to our bloodstreams. When red blood cell production rises, our muscular endurance increases and we recover with more ease. Another positive aspect of NPP is that it will boost the synthesis of collagen and the content of bone minerals. If you want stronger cartilage and bones, as well as the capacity to recover from problems with bones and cartilage, then this anabolic steroid will likely be helpful. In particular, the enhanced collagen production and bone mineral production triggered by NPP will make good joint health easier to achieve. NPP is also used in order to treat an array of medical conditions. Patients with HIV and cancer may benefit from injecting it, as may patients with fatigue and muscle wasting illnesses. As well, those who are anemic may benefit. Other examples of conditions which may be treated with nandrolone phenylpropionate include breast cancer, anemia, pituitary dwarfism, serious burns, ulcers, mental development problems in children, and osteoporosis. While it does offer benefits to a lot of different types of patients, in America, it's typically prescribed to people who suffer from anemia, AIDS or HIV. It's quite successful in terms of improving patient outcomes. In other parts of the world, it may be prescribed for other types of illnesses, in addition to the ones it's used to treat in the USA. There are some incidences of it being used to slow down the aging process. Effects of nandrolone phenylpropionate, NPP. By now, we've reviewed some of the main properties of this anabolic steroid. We know its key traits and functions. Now, we'd like to share information about how NPP helps performance athletes. Most people who are interested in NPP do fit this category. In the off-season, a performance athlete will typically enter a bulking cycle and NPP is an effective steroid for this phase. It's designed to boost size and muscularity. If you want a mass builder, which a lot of bodybuilders rely on, you'll find that this one delivers. While it's quite fast-acting, growth won't be rapid. However, growth will occur in a steady manner. Bear in mind that you'll need to consume enough calories to grow effectively. This means eating more calories than you burn off. If you eat properly, you'll get maximal benefits from NPP. Also, performance athletes may find that their bodies are leaner because this hormone speeds up their metabolisms. Also, recovery from training and injuries will be easier when you add nandrolone phenylpropionate to your bulking phase routine. This hormone is also a popular choice for cutting cycles. However, it's more renowned as a bulking steroid than a cutting one. When you use it for cutting, it will keep you from losing lean muscle mass. Unfortunately, when we begin to slim down during cutting phases, we run the risk of losing precious muscle tissue, as well as fat. This steroid will protect the muscle tissue that bodybuilders work so hard to keep. If you want superb joint discomfort relief and recovery, NPP may be right for you. A lot of bodybuilders use it in smaller doses in order to access this benefit. The steroid doesn't mask symptoms. Instead, it provides real relief. Strength gains may also happen with this steroid. However, it's not usually chosen for this reason. Now, let's talk about the downside. With steroids, there is always a downside. As we mentioned earlier, this steroid is one that most people tolerate well. However, you need to know the risks. Nandrolone Phenylpropionate (NPP) side effects. This steroid does cause side effects in some users. However, it's definitely not one of the steroids which is known for its nasty side effects. If you want to avoid or manage side effects from NPP, you need to understand how the steroid works. We've offered detailed information above. In most males, it is possible to avoid all side effects of this anabolic steroid. Here are the most common side effects associated with NPP. Estrogenic. Since this steroid is estrogenic, it may trigger development of male breast tissue, bloating and higher blood pressure. To avoid these side effects, men may wish to use aromatase inhibitors. Androgenic. The risk of androgenic side effects is lower, but not non-existent. Examples of androgenic side effects include acne and hair loss, male pattern baldness. In women, virilization is a possibility. If women notice virilization problems, they should stop taking NPP immediately. For example, a woman may find that her clitoris grows larger, that her voice deepens and so on. It's important to stop injection of this steroid immediately if these problems begin to manifest. Female side effects. When a woman stops using NPP right away, the chances of the virilization symptoms being reversed will be great. If she persists in using the steroid, despite symptoms of virilization, it's possible that the symptoms won't reverse. Cholesterol. This steroid may negatively impact good cholesterol levels. Testosterone inhibition. This hormone will inhibit the production of natural testosterone. Men who use the steroid should do so while using exogenous testosterone. Poor protection from overtraining. Some males experience decreased libido, not true for women. Inhibition of HPTA function at dosages in excess of 400 mg weekly. Nandrolone binds to the androgen receptor to a greater degree than testosterone, but due to its inability to act on the muscle in ways unmediated by the receptor, has less overall effect on muscle growth. The drug is also unusual in that unlike most anabolic steroids, it is not broken down into the more reactive DHT by the enzyme 5A reductase, but rather into a less effective product. As such, some of the negative effects associated with most such drugs are somewhat mitigated. NPP dosages and administration. For best results and to minimize the risk of side effects, 50 to 100 mg, 50-100 mg of NPP per day is recommended. This injectable steroid can be used daily or 3 times per week. Advanced level bodybuilders can use larger doses, such as 400-800 mg per week. It's suggested NPP should be used with a form of injectable testosterone as deca-dic can be apparent when testosterone is fully suppressed to hypogonadal levels. For women, 50-100 mg per week should be adequate and limit the amount of negative side effects experienced. Women seem to do very well with nandrolones due to the lower androgenic, masculining effect. Women consistently reported excellent lean mass and strength gains at dosages of 50 to 100 mg weekly. Masculine effects usually were avoided by single weekly injections of 25 to 50 mg nandrolone decanoate and 25 to 50 mg of nandrolone phenylpropionate. In both men and women, this method seemed to result in more quality muscle, less water retention, less gyno for males, and good retention of gains after the cycle ends. Metabolites can be found in urine or blood tests for 12 to 18 months after use of nandrolone is discontinued. Nandrolone Phenylpropionate (NPP) legality. In America, NPP is not legal unless it's been prescribed by a licensed physician for medical reasons. Those who want NPP tend to turn to underground labs. It's not legal to buy this anabolic steroid in the United States. In fact, its world supply is a bit limited in general. It's actually easier to find nandrolone decanoate. In general, those who buy from underground labs find that nandrolone decanoate costs more. People also buy NPP online. Yes, it's not legal in America, but they buy it anyway. It's actually considered a controlled substance, Schedule 3, in the USA. We're sure that you're apprehensive about breaking the law. For this reason, we encourage you to seek out legal steroid alternatives. Many of them are amazing and offer exceptional, steroid-like benefits, without the steroid downside. Legal steroid alternatives are specially formulated to give users similar benefits to NPP and other anabolic steroids. The legal steroid alternatives have come a long way and most cause few or no side effects. They are legal to buy online, they are typically affordable, and they are designed to help bodybuilders achieve their training goals year-round. Now that you have the inside scoop on Nandrolone Phenylpropionate, you'll be able to make a wise and informed decision about whether or not it's right for you. In our opinion, it's one of the safer, more well-tolerated steroids. However, it's not legal for sale in too many places, and this is a significant drawback. Designed to help bodybuilders who are bulking or cutting, this popular anabolic steroid is available by prescription only and likely always will be. If you want the same benefits as NPP, without the disadvantages, it will be wise to find a legal steroid alternative which is designed to mimic the benefits and properties of Nandrolone Phenylpropionate.